Hi, my name is Hope Otrogi and I'm the medical provider over at Frisco Memorial Hospital. I hear you are taking over this case and I'm here to give you a brief overview about this patient. The patient's name is Justin Nguyen. His date of birth is March 12, 1969 and he is 56 years old. His gender is male and he was admitted into this hospital on the 1st of July. A brief overview of his case is that he's a 56-year-old male who was admitted to the emergency department with complaints of chest tightness, shortness of breath, and pain radiating to his left arm. The symptoms began during moderate activity and did not resolve with rest. The patient reports similar episodes over the last month, but this one was much more severe. Past medical history includes hypertension, and he has no known drug allergies. When he came into the clinic, we gave him a physical examination, and the report includes information about his temperature, pulse, blood pressure, height, weight, and general appearance. It also has information on the sounds of his heart, lungs, his abdominal region, and his muscles. The first clinical impression we received was that he has a coronary artery disease secondary to atherosclerosis. We therefore ordered some exams. He received an electrocardiogram exam, echocardiogram, and a cardiac catheterization. Findings from these exams was that in the cardiac catheterization, it showed signs of stenosis in his left anterior descending artery, which confirms atherosclerosis. The ECG indicated signs of myocardial ischemia, and the echocardiogram was a cardiac ultrasound used to visualize the heart structure where they found no infraction present. Common blood work showed that he had elevated cholesterol and triglyceride levels. The impression we received was that he had atherosclerosis with significant coronary artery narrowing, and so the preoperative diagnosis we concluded was that he has severe coronary artery disease due to arteriosclerosis. The procedure that we decided on was a percutaneous transluminal coronary angioplasty, or a PTCA, with a stent placement. Description of the procedure that was done on him was that the patient was placed under conscious sedation, and after a sterile preparation, a catheter was introduced into his left femoral artery and guided to the heart. A balloon catheter was then inflated at the site of stenosis in the LAD artery to restore proper blood flow. A coronary stent was then deployed to improve blood flow in the heart even after surgery. The catheter was removed and homeostasis was achieved at the access site. The patient was tolerable to the entire procedure, and he was transferred to recovery in stable condition. The final diagnosis we came to was that he had atherosclerosis with the coronary artery stenosis. The procedure that we completed on him was an angioplasty with a successful stent placement. The plan for his discharge is for him to be released on the 2nd of July with prescriptions for aspirin, and he was introduced and instructed to follow a low-fat, heart-healthy diet and engage in supervised cardiac rehabilitation. We scheduled a follow-up with him with a cardiologist in 2 more weeks.